Okay, welcome everyone. This is the program that we're going to talk about. This is Medicare Part D drug plans, and this will be explained to us. Our presenter today is Charles Clarkson. I would appreciate it, some Zoom etiquette, if you could be on mute. If you have any questions, we can save them for the end of the program. Is that okay with you, Charles, that we saved it?
Whatever you prefer, I don't care either way.
Okay. All right. So, Charles, welcome to the Parsippany Library. Take it away.
Okay, thank you. Let me just introduce myself a little bit and who I represent, and then I'll start sharing my screen. My name is Charles Clarkson. I am the project director of the Senior Medicare Patrol of New Jersey. And we are funded by the federal government, and we help people fight Medicare fraud, waste, and abuse. And we also help people and educate them about Medicare and answer any of their Medicare questions. So today, we're going to talk about Medicare Part D and show you how it fits into the overall Medicare territory or world or wherever you want to call it. So I'm going to share my screen, and then we can start. Okay, all of you can see this. Well, again, the Senior Medicare Patrol in New Jersey, that was our logo on the left, and Part D. And let's see how Part D fits into Medicare. Okay, so this is Medicare. When most people join Medicare, they have two choices. On the left, you see Original Medicare, and on the right, a Medicare Advantage plan. So whether you're in Original Medicare or Medicare Advantage, everybody has Part A and Part B, or should try to get Part A and Part B. Some people may have to pay for Part A because they didn't work enough for 10 years and may not take it originally. But in most cases, out of all the millions of people, most people have Part A and Part B. And then they have to decide, should I go into a Medicare Advantage plan, either an HMO or a PPO that combines everything into one program? Or should I buy a supplement and a standalone prescription drug plan, as you see on the left? Now, both Medicare Advantage and Original Medicare have Part B prescription drug coverage. With a Medicare Advantage plan, it usually comes with the plan and you don't have to pay extra for it. If you're in Original Medicare, and you have Part A and Part B, most people realize that Original Medicare doesn't pay for everything, and there's like a 20% that you have to pay out of pocket yourself. So most people, I'll use myself as an example, buy a supplement plan. So I have an AARP United Healthcare F plan, which you can no longer buy, but it's a supplement plan. And then in order to cover my drugs, I buy a standalone prescription drug plan. Okay, but if I wanted to get everything in one, then I can join a Medicare Advantage plan. I don't need to buy a supplement, and I don't need to buy a standalone Part D because that's included in the Medicare Advantage plan, which is known as Part C of Medicare. So this is what happens when you have a Part D prescription drug plan, okay? I mentioned there's a standalone plan like I have. In other words, I go online and I search on the Medicare site called a plan finder. I put all my drugs in. I put in the drugstore I use, and I get the best plan for me. And last year I switched plans. I'm now in the Humana Walmart Part D drug plan, and that's a standalone drug plan. And I mentioned that Medicare Advantage also has drug coverage, and most plans, Medicare Advantage. Now, if you're a veteran and let's say you're getting your drug coverage from the Veterans Administration, well, you might want to pick a Medicare Advantage plan without drug coverage because you don't really need the drug coverage. And there are plans called veteran plans that are really highlighted to people who already have drug coverage from another source. And that's what the bottom one is. So let's say I retired and I have coverage from my job that I still get after I retire. Well, is if I'm still working, I don't need Part B, and I don't need a drug plan because my job has that coverage. And that's called credible coverage. That means another plan gives me drug coverage which is equal to or as good as or better than Medicare Part D. So I don't need to buy a drug plan. Now, when I retire, as someone on this call is, I need both A and B because I'm no longer actively employed. And if the question is, do I have drug coverage from my job, which continues? If I don't, then I need to either join a Medicare Advantage plan or join a separate standalone Part D plan in order to get drug coverage. And that's the three choices I have. So let's go down. Okay, so in 2021, I mean, what's really difficult about picking a Part D plan is that there's so many plans to choose from many different companies. And you all know the companies, the Aetnas, the Humanas, the United Healthcare, the Blue Cross Blue Shield. All of these major companies offer Part D drug plans. And they may even offer more than one plan in their own network. So how do you make a determination about what to buy? And we'll talk about that a little later. And you can see all of these companies that you buy a drug plan from are approved by Medicare. So you don't really have to worry about them being, fly-by-night organizations. These plans are all approved by Medicare. And what you have to realize, and the biggest understanding that I want to educate people about, is that these plans change every year. And my drugs may change every year. So every year there are open enrollment periods, and we'll show a slide on that. And I want to make sure that I pick the best plan for the next year. And the open enrollment starts October 15th and goes to December 7th. And if you can't do the plan finder on Medicare.gov yourself, which is the website, you can call the SHIP program in your county, and they can meet with you and basically do a search on your Medicare Part D plan, depending on the drugs you have and your pharmacy and things like that. Now, most of these plans are limited by jurisdiction. So if you travel a lot, let's say you go to Florida 6 months of the year, well, you might want to pick a plan, even though it might be more expensive, that is national in nature. In other words, I could travel to any state and I could then go to my drugstore and pick up my drugs because there are national plans. There aren't very many, but there are some out there. Okay, and how do these plans work? Well, these plans want to make money, so they charge a premium. So if I'm on a Part D drug plan, for instance, my Part D drug plan costs $17.20 a month. I pay that regardless. And my plan has a deductible, and the deductible is $495. So if I go to the drugstore on January, the first month of the year, I have to spend $495 first before my drug plan kicks in. And then I go into the payment phase, which is basically they cover 75% of my drugs and I have to pay 25%. Now, remember, these plans don't want to give everybody the most expensive drugs and cover every drug. So what they have are formularies. And a formulary is just a fancy way of saying a list of drugs that we cover. And one of the things that you have to do every year is search the plans based upon your list of drugs and make sure it's in the plan's formulary. Because if it's not in the formulary, then they're not going to cover that drug. You can appeal, you can ask for a determination, but a lot of times they're going to say, no, we're not going to cover that drug, and you're out of pocket because you didn't bother to search and see if your drug is in the plan you're in or in the plan that you might want to be in next year. And these drugs basically have tiers, and you can see tier 1, which is preferred generics, and a lot of times that means it has a very low copay. So, and a lot of times if you look up plans, they'll cover tier 1 and tier 2 drugs at a zero copay. But once you get to tier 3 or tier 4 or tier 5, those are branded drugs or specialty drugs, and you can pay a lot of money out of pocket for the copay. So when I go to the drugstore, let's say I used up my deductible and I'm buying a very cheap preferred generic, let's say lisinopril for high blood pressure. Well, that might cost me $0, okay? But if I'm getting a brand and there's no other generics available, that brand might cost me $50 to $75 copay because it's an expensive brand drug. And my doctor put it on because he thought there was no other drugs and there are no generics available. So it does depend on what drugs are covered and what drugs you're taking. And we always encourage everybody, if you can't do it yourself, please sit down with a ship counselor and check and see what the best plan. Last year I was on an Aetna plan, and then when I did the search, it said that here's a Humana Walmart plan that was cheaper, so I switched plans. And everybody should plan on doing that. If I leave you with one thing today, always make sure you do a comparison from year to year, and you do that during open enrollment. Again, October 15th to December 7th, but the plan will not take effect until January 1st of the following year. Now, of course, some drugs are considered not prescription drugs like over-the-counter or cosmetic or things like that. Those are not covered by Medicare. And of course, you see the examples here. Vitamins are not prescription drugs, so they're not covered under a Part D plan or a Medicare Advantage prescription drug part. Rogaine, because I don't like being bald, so I want to use Rogaine. The plans will not pay for that. And of course, lifestyle drugs like Viagra and others. But basically, a prescription drug where the doctor writes out a prescription, you bring it to your pharmacy, and if it's in the formulary, they will cover it. Now, I mentioned that these drug plans want to make money. They're not in this business to lose money. So besides the premium, plans may have other limitations on the use of the drugs. And here are the three that they're allowed to have. Quantity limits means because maybe the drug might be somewhat dangerous, they might limit the amount of pills you can get at any one time. Right now, during the pandemic, you can get up to 90-day supply for most drugs because they don't want people to have to keep going to the drugstore during the emergency. So I don't worry about quantity limits so much. If I see a plan and the drug that this person is on would only allow 30 pills a month, fine. That means I just have to go to the drugstore or get mail order more times. That's not a big issue. The next two are problematic. Prior authorization. That means this plan that I'm in is not going to cover that drug unless they approve it first. And of course, you know what that means? That means this drug is expensive and they don't want to pay for it. So they're not going to give prior approval to very expensive drugs. So if I see a plan where somebody's drug list says that this drug requires prior approval, I try to find another plan that will have that drug, but not have prior approval. And step therapy is the next one that I avoid. That means my doctor has given me a drug that's expensive. And the plan says, before we'll pay for this, you have to try this other drug first. And if that doesn't work, then you'll have to try this second drug. Then and only then we'll basically cover the drug that you're on. So it goes in steps. And why this is a problem is because, if you have to try a drug that doesn't work, then you have to take some time before you get to the steps, before they get to the drug that you're on that the plan will cover. So when I'm doing, and I'm also a ship counselor in Middlesex County, when I'm doing comparisons for people, I try to keep them out of plans that require prior authorization or step therapy. And that's very important. Now, if we have no choice, if this drug must be covered, a lot of plans might say none of them are covering this drug or all of them are requiring prior authorization. Then I don't have a choice. So again, it depends on what drug you're on. Okay, now one of the big issues in a plan is that there's a network of pharmacies. Now, most pharmacies are all in the network. That's not much of an issue. But there are two standards there are two levels of coverage for a pharmacy. One is a standard pharmacy, and another one is a preferred pharmacy. So I mentioned my drug plan. I'm on the Humana Walmart. So what do you think the preferred pharmacy is? Walmart. That means if I go to Walmart, I save the most money because they give me a preferred pricing level. So if I want to save money, I'm going to take all my drugs from Walmart, which is what I do. It doesn't mean I can't go to other pharmacies, but I have to realize if I go to a pharmacy that's only a standard, I'm going to pay more for those drugs. And of course, some plans have mail order. And in the past, the mail order might have been cheaper. We're not finding that anymore. But if you can't go out to the pharmacy, you don't drive, or you have other limitations, then you can look for a plan that has a mail order component and basically get the drugs through mail order. Now, so we have these 30 plans, and I mentioned that they have premiums. So as you can see, the range is quite large, from $7, and actually that plan is $7.30 a month, all the way up to $97 a month, with the average being $37. And I mentioned the deductible. So the deductible for 2021 is $445. Now, I know every year that deductible is going to go up, and it's always announced in the fall as to what deductibles can be for the following year. Now, not all plans charge the full deductible. Some plans may say, okay, we're only going to give you a $100 deductible. But don't think they're giving you a bargain because they lower the deductible, because in most cases, if they lower the deductible, they increase the premium for the plan. So, and you can see these are the different phases of the plan. So you have the deductible phase, which I mentioned, the initial coverage. Once I pay $445, then I guess I get coverage from my drugs until I spend $4,130. And then it's called the coverage gap or the donut hole. Many of you have heard of the donut hole. And during this phase, I pay 25% of the cost of the drug. So if the drug is expensive and I hit the donut hole, I can pay a large copay because some drugs are quite expensive. Some drugs can cost, a couple of $100 a month, or sometimes even higher, $1,000 a month. If I have to pay the donut hole 25%, that could be a huge copay. But if I'm on a lot of drugs and I reach 6,550, then I go to catastrophic coverage. And during catastrophic coverage, most of my drugs will cost $3.70 for a generic and $9.20 for a brand, or 5% of the cost, whichever is higher. But that saves a lot of people. There are many people who never reach the catastrophic limit, and that's most of us. In other words, we'll never spend that much money on drugs to get to catastrophic coverage. More of us will hit the donut hole, but even then, I have to spend $4,130 out of pocket even before I reach the donut hole. So if I'm not taking very many drugs, I'm probably just going to get to the first two phases, which are the deductible and the initial coverage phase. So how do we compare plans? I mentioned what's important. Well, obviously, the coverage. All my drugs covered in the plan. And then, of course, are there any restrictions? I talked to you about prior authorization and step therapy, which I try to avoid. And then the cost. I want to know, what is it going to cost me? Not just the premium, but what is it going to cost me with my copays, with my deductibles? And if I go on to the Medicare Dove plan comparison site, it tells me what the annual estimated drug costs are. And that includes the premium, the deductible, and all the copays based on the drugs I put in. And of course, convenience, well, that's pretty straightforward. Usually there are a number of drugstores that are near you that would be preferred. But a lot of people don't want to travel too far to a drugstore. So even though the drugstore is not preferred, it's in the network and it's some pharmacy or drugstore that they like to use. So they want to keep going back. And of course, you should always determine how this works with your other health and benefits. And I mentioned one case where if I'm still working and I have drug coverage from my job, but I'm still actively employed and my drug company gives me credible drug coverage, I don't need to buy a drug D plan as long as I'm continuing to work. Once I lose my coverage from my job, then I might have to get a Part D drug plan. Okay, and this is just a look at what the website looks to find the best Part D plan. So if I go to medicare.gov and I /plan-compare, I can open an account or I can proceed as a guest. I don't have to open an account. I would encourage, if you know how to use the computer, I would encourage all of you to open what's called a My Medicare account. Why? Because if I am doing drug comparisons and I open an account, the comparison will automatically add all my drugs to the list. So I don't have to type in the 5 to 10 drugs and the dosages and the cost. It does that for me. So I find that very, very helpful when I'm comparing drugs for people. So, excuse me one second. So having a My Medicare account does make this process easier. And another advantage of having a My Medicare account, you can look up all your claims online. You don't have to wait the 3 months before you see a Medicare summary notice or a statement from Medicare. So, a lot of times people are in a drug plan and the doctor may add a drug during the year because you have a certain condition and they have to prescribe a new drug. And what happens if that drug is not on the plan? Because remember, you're getting a new drug and that formulary for the current plan you're in may not be expansive enough to cover the current drug. Well, you should work with your doctor and say, Doc, this drug is not in my current plan and I can't change until next year. Is there another drug I can take which will do the same thing and will be on the formulary for the plan? That's certainly possible. If it's not possible, if the doctor says, you have to really take this drug, you don't have a choice, well, then you can ask for an exception saying, hey, plan, will you cover this drug for me because the doctor says I have to have it? And in that case, you have to get your doctor involved. The doctor will write a letter to the plan justifying your use of this drug and that no other drugs will be available for your condition. And of course, I mentioned the open enrollment from October 15th to December 7th. So every year, starting from October 15th, I help people compare drug plans. And we then determine if there's enough of a savings to switch plans. If it's only $1 or $2 and you're happy with your current plan, then most people don't bother changing. But if you can save a couple of $100 a year or even $1,000 a year by switching plans, then you should do it. Because remember, it's your money. Okay, why is this not going down? Uh-oh. Okay.
There we go.
Now, what is the Part D late enrollment penalty? Well, that's pretty straightforward. So let's say I enroll in Medicare for the first time, and I've seen cases like this, so this is not out of the ordinary. The beneficiary would say, I'm healthy. I'm not going to bother getting a Part D drug plan now. I'll wait until maybe later on if I get new drugs, because right now I'm not taking any drugs. Why should I pay a premium for a drug plan when I'm not taking any drugs? Well, that's a mistake, because if you don't get a Part D drug plan when you're first eligible to, then you could be penalized 1% a month for every month that you don't take the Part D drug plan. And what happens to people is they go a couple of years without drug coverage. And then when they get sick, all of a sudden they're on these drugs. But now 2 years have gone by and they're going to pay 24% more for a penalty. And penalty is not based on your plan. It's based on the national average cost of all plans put together. So if the average is $37 nationally, doesn't sound like a lot. You're going to pay 37 cents times 24 for the penalty. And remember, as these national average costs go up for these plans, your penalty will also increase. So I tell people, look, you're healthy, you're not taking a lot of drugs, great. Just pick the cheapest premium plan. Pick the $7.30 plan so you don't have to worry. And then when you have to add drugs, at least you will have drug coverage and you're probably going to be covered for most of your drugs. And if you have to, you could always change plans later. And I said, remember that the penalty will continue as long as you're in Medicare and have a Part D drug plan. So I talked about the enrollment periods. So remember, when we first enroll in Medicare, we have something called the initial enrollment. And that's the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and 3 months thereafter. And most of us enroll with Medicare, and I would advise you. So let's say my birthday is August. Well, 3 months before would mean July, June, May. I actually could enroll in Medicare right now. I should not wait for the month of the birthday or afterwards, because every month I delay, it takes longer to get Medicare coverage. And so you want to avoid that. I mentioned the annual open enrollment period, October 15th to December 7th. This is where the period where most people make their changes. They sit down with the SHIP counselor, and the SHIP counselor says, hey, we have all these plans. This is the cost of the various plans. You can save a couple of $100 or $1,000. Do you want to switch? Now, they can't make you switch, but for me, if you can get the same coverage for less money, why wouldn't you do that? Remember, most of these plans are approved by Medicare, so you don't have to really worry too much, and they all basically have star ratings. And if you are rated low over a number of years, you're going to be removed from the program. So these Part D plans are really something you don't have to worry about the quality or getting the right benefits that you need. And of course, there's a Medicare Advantage open enrollment. This is relatively new. So from January 1st to March 31st of every year, if I'm already in a Medicare Advantage plan on January 1st, I can switch Medicare Advantage plans, or I can go back to original Medicare and try to pick up a supplement and a drug plan. So that's an additional period. And of course, there are special enrollment periods. And most of these enrollment periods happen because, let's say you move out of state, you're in a different location, your plan may not cover you where you move, so you get a special enrollment period. If you lose your job and you lose your coverage, well, then you might get a special enrollment period. And of course, if you leave or reside or enter into a nursing home, you get special enrollment periods. And these special enrollment periods usually last 63 days. So if let's say I lost my job and I want to enroll in Medicare for the first time because I didn't need it when I was working, well, I would have 63 days to pick up the parts of Medicare I need, and I will not be penalized because I already had coverage from my job. Now, there are plans in the state of New Jersey, I mean, not plans, but programs, which help you pay for your Part D drug costs. And the most valuable one is the New Jersey Pharmaceutical for the Assisted to the Aging and Disabled program. And this is known as PAD. Many of you have heard of PAD, and it is based upon income. And you can see the income here for a single person is a little over $28,000. For a married, it's a little over 35. Okay, and if you get on PAD, PAD pays the premium for the drug plan, and there's all your drugs are either $5 for a generic or $7 for a brand. Now, you can't get any better than this plan if you're a low-income person. And by the way, as part of the new budget for next year, this hasn't been approved yet, but they might raise the limits of the PAD program. Instead of 28,000, it'll be a little over 38,000. So, and for married, 45,000. So that's going to allow a lot more people to be eligible for the PAD program. So, and of course, there's no deductible. So it pays the premium, the drug costs are low, and it pays for the deductible. And if you qualify for this program, I would certainly recommend that you do so, because it is one of the great programs, to help people pay for their drug costs. Another program is the New Jersey Senior Gold Program. Now, this is a program based on a higher income. And again, if the program goes through it based on the budget, instead of 38,000, it'll be 48,000 to be on Senior Gold. And this is more of a discount program. So I would pay $15 for the drug plus 50% of the remaining cost. So if it's an expensive drug, it could still be a little more, it could still be expensive for you. But again, if it helps people who are in a little higher income, then they should apply for the Senior Gold discount program. So let's get back to what I said earlier. These plans change every year. The costs change, the formularies change, the premiums change, the co-pays change, the deductibles change, and of course, the formularies change. So I want to make sure I'm in the best plan next year. So how do I do that? I do that by doing a plan finder comparison. And if I can't do that myself, I'm going to go to a SHIP program with the State Health Insurance Assistance Program and let them help me decide what's the best plan. And they can do all the work for you, and they'll give you a choice. These are the 3 cheapest plans, and you have a right to change or not change based upon your judgment. But I always tell people, why spend more and stay in your current plan when you can switch to this plan, which is approved by Medicare and will save you hundreds of dollars a year. And of course, if you're not happy with the quality of care, or you have some complaints about how the company is answering your phone calls, you're allowed to file a complaint with the plan or with Medicare. And a lot of people do so. And remember, these plans are rated. So if they get a lot of complaints and their rating gets below a certain level, they can be removed from the Medicare Part D drug plan. Okay, so we've talked about this, the open enrollment, where I can make changes to the plan. Let's take advantage of this, because it'll help us all if we're in a better plan. And I check for myself every year. I check for my wife. I check for a lot of my friends. And I say, hey, there's a better plan out there. Switch plans. And of course, as part of the Senior Medicare Patrol, please avoid Medicare scams. Medicare will never call you. Social Security will never call you. The IRS will never call you. So if you get a call from anybody saying they're from a Medicare, just hang up the phone. Of course, you should never answer the phone in the first place. If you have a screen on your phone and it lists the number that's calling and you don't recognize the number, don't pick up the phone. If you pick up the phone and you realize it's a scam, just hang up. We call that slam the scam. You don't have to worry about being nice to them. Just hang up the phone and don't interact with them. And of course, protect your Medicare card and Medicare number at all times, because even though the Medicare card now has a different number than the Social Security number, it still has value. If someone stole my Medicare card, they can get services in my name, and that can affect my medical record and what I have to pay in the future if I need those services. And of course, Medicare will never send representatives to your home. And be very careful about reaching out to an agent or a broker. I know a lot of people have agents and brokers that they they deal with and they trust. Well, I have no problem with that, but if you need an unbiased viewpoint, speak to a ship counselor. So, and I mentioned the SHIP program, again, State Health Insurance Assistance Program. The number is on the screen here. Every county has SHIP counselors and they're free and they're well-trained and I would recommend them highly. And I help people during open enrollment because I'm also a SHIP counselor and I help out. And in the past, we met one-on-one because of the pandemic. We did everything by phone or by email and even by Zoom because we can talk to people live. And this is their this is their state number, 800-792-8820. So here's my contact information, should you need it. We also have a website with all this information on it. It's called www.seniormedicarepatrol.org, www.seniormedicarepatrolnj.org, or you can call us at 732-777-1940. And we also have a hotline, 877-SMP-4359, and you can contact us at any time. So that's my presentation about Medicare Part D. Does anybody have any questions I can help them with?
Yeah, actually, I have two questions. But let me see if I can. Here we go. There we go. I have two questions. One is, what do you think of this Good RX? You know, you could get.
Really, Good RX and the other discount cards are really meant for people who don't have drug coverage.
Okay.
Okay. I mean, in my comparison, in my experience, I'm not saving any money by using a Good RX card. Now, if my drug is not on the formulary and it's not covered by anybody and I can save money by using my Good RX card, fine, use it. But I have found that if my drug plan, my Part D drug plan will save me more money than any discount drug card.
Okay. And I have the other question is do you have to pay for SHIP counseling?
No, SHIP counseling is free. That's why they're great. And
Okay.
I know I help train SHIP counselors about fraud in Medicare and also some other areas. So they are highly dedicated people and they take a lot of training. I mean, every year, not only do they have to get initially trained, but every year there's update training. So they are great people to meet with and to determine whether or not you can save money and get help. If you have any questions about Medicare and you don't know the answer, talk to a SHIP counselor.
Okay. Banu or Sue, if you want to unmute yourselves and ask any questions. Charles, would you stop screen sharing?
No, it's still on.
Okay. I don't know if you want to leave it up.
I'll take it down.
I didn't know if anybody wanted to take a picture of that or, you know, I think you both have.
I would be happy to send you the PowerPoint and you can disseminate it as you see fit.
Yeah, it will be nice.
Okay.
Okay.
And I know, and I know this is complicated stuff, especially if you're doing it for the first time.
Yeah.
And you're new to Medicare and it's very difficult to pick a Part D drug plan, 30 plans. I mean, you're not going to call every plan, right? And
You might, I guess.
have a spreadsheet, that's ridiculous. That's why Medicare came up with this plan finder, because it does the work for you and it tells you what your estimated annual cost will be. And I always pick the cheapest plan. And I said, that's good enough for me.
Yeah, but if you're married to an engineer, there's a spreadsheet for everything. So there probably will be a spreadsheet.
Well, tell them they don't need a spreadsheet for the plan Part D.
Okay. Banu, do you have any questions right now?
Yeah, I have a question, but I just want to find out, do we have time for that?
Yes, absolutely.
Okay. First of all, there are agents also available who are taking the plans and advising them without any cost, or also is it safe to do with them? They will guide you properly.
All right, I told you my opinion because I'm biased. I would prefer that you call a SHIP counselor and go over all your options. Remember, the ship counselors are not selling anything. They don't represent insurance companies. They don't represent plans. So they're unbiased. So my feeling is, look, if you want to go to an agent or a broker that you trust, and I put that in quotes, that you trust, fine. But you can trust the ship counselors because they are trained and they're trying to be unbiased. And not only that, they can't tell you what plan to enroll in. They can only make recommendation based upon their comparisons.
Thank you. And in that case, I think she's going to get the details and I will be able to run all the, once again, all the slides and I will be able to see that.
Mhm.
Oh, that's good.
Yes.
That's good. So I will have at my piece, I will understand because I'm not expert in English or understanding in English
No,
also.
well, yeah, and then look, a lot of people, even though,
Yeah, have translator, no?
right, a lot of people might not be comfortable doing this on the computer, so
Yeah,
I
I do
always say,
understand.
right, so I
But
say
it
to
is
people,
nice. It is nice to have on computer and understand at
sure,
the
sure, but
stages.
I've been doing this for years, and every year I have to learn more about the Medicare Part D and the Plan Finder. So don't feel that you have to know this stuff. This is what SHIP is for. Remember, this is your tax dollars paying for a program to help you decide what your best options are for Medicare. Take advantage of it.
Thank you very much.
You're welcome.
That's
And like I said, Benu, this is going to be on the YouTube channel.
oh, that's very good. That's very good.
And I can
YouTube
always-
of library site.
I will send you the link in an email because I believe I have your email.
Okay, thank you very much.
Yeah, and Sue,
I
I could
appreciate
send it to you also if you would like.
That'd be great. Thank you so much. And Charles, I just want to thank you. You cleared up a lot. You gave great information. This is the most I feel comfortable with having to make a decision for next year.
Good.
Yeah, well, it's, even my wife, she's a lawyer and she probably could do this herself, but she says, you're the expert. Why would I want to do it? So I do it for her and I do it for a lot of friends because it's complicated,
Yeah,
not knowing how to use the plan finder. I've taken a lot of training on it and stuff like that. And every year it changes, it gets better every year. So we recommend that if you can't do it yourself, and I don't mind you doing the plan finder yourself, but if you can't do it yourself, SHIP is the best way to go.
that's good to know. That's very good.
I do have a question, Charles.
Yes.
Do the ship counselors also help you in figuring out what supplemental insurance is available if you want to go with the original Medicare?
Yes.
Because that's another thing that
Yes,
extremely
absolutely,
uncertain about.
because the plan finder has very minimal information about supplement plans. Okay, but the ship counselors will have charts that especially when you're turning 65 for the first time.
Correct.
I know they have a chart of all the premiums and all the companies and all the lettered plans that are being sold in New Jersey. So yes, if you want to know about a supplement plan, yes, absolutely, speak to a ship counselor.
Okay, great. So a birthday of February turning 65 should start looking into this in January, December, in October or November?
Yeah, November.
November.
3 months before. And I would recommend that, you speak to a ship counselor, before the month of November, just to get some idea. And then in the November, you can enroll. And then it'll become effective the month of your birthday. If you wait for the month of your birthday or the second month or the third month, there's a delay in getting coverage. And there's no reason not to have your Medicare coverage start the day one of the month you turn 65.
Right. All right, so if you're not 65 yet, ship counselors will still talk to you then.
Oh, absolutely. Yeah. If
Okay,
you want to
perfect.
just get familiar and what your options are. I mean, I kind of gave you the initial choices, original Medicare, Medicare Advantage, but they have charts and they can give you lists of plans that I know that I have charts from SHIP that show all the Medicare Advantage plans, all the Part D drug plans, all the supplement plans. So if you want more information, so you have time to look at it and review it, feel free.
Perfect, thank you.
May I ask a quick question?
Yes.
I have PAAD program drug plan. And now is it advisable to try change for the advantage or no?
I see, I can't answer that question unless I know more about you.
I see.
And you have to remember, if I'm in a Medicare Advantage plan, there are some disadvantages.
Yeah,
Besides-
I did recognize that today.
Yeah, I mean, besides these extra supplemental benefits like hearing, dental, and eyeglass, and now they're offering even more benefits, you know, you have to remember, are all my doctors in the Medicare Advantage plan? Is the hospital I want to go to in the Medicare Advantage plan?
Okay.
Do I need prior authorization for certain tests?
Mhm.
What if I need a specialist? Is the specialist in the network? Is the specialist in the plan at all? So don't just presume because you see Joe Namath on television offering all these additional benefits. Yes, but there are some downsides. And if you're unhealthy, maybe a Medicare Advantage plan may not be the best place for you because then you're limited to their network.
Mhm.
You know, and one of the reasons I never joined the Medicare Advantage plan because I wanted to go to any doctor or specialist that's enrolled in Medicare. I don't want to have the plan to tell me who I can go to. So I spend a little more each month, but I'm happy to do so because I think I have better coverage.
I
So
see.
it sounds
the
like
day-
to me, that making an appointment for you, Banu, to speak with,
Yeah.
someone at SHIP, either, in person or maybe on a Zoom call or something to walk you through.
Right. What county are you guys in? I always forget.
Morris
Morris.
County.
So I don't know if the Morris SHIP program is still doing remote or in person. I know they're opening up. So you should check with the Morris County SHIP program. And you can call the state number that I gave you earlier and they'll connect you to the Morris County SHIP program. But if they're meeting in person, then feel free to meet with them.
Does that sound like a good idea?
Great advice. Thank you.
In that case, is it eyeglasses and hearing aid and dental? Is there is a separate plan will be available? There are so many
Yeah,
advertises coming.
those additional benefits are only in Medicare Advantage plan. They're not covered under original Medicare. Okay, so if those benefits are important to you, like one new benefit that's being offered is one-way transportation, maybe a number of times a month. So let's say you didn't drive, but you had to go to your doctor. Well, maybe a Medicare Advantage plan will pay for that trip to and from the doctor. So that
see.
could be something important for people. But remember the limitations, the network, and all the other rules that you may have to follow. That's why a SHIP counselor will tell you your options and what might be best for you. And
It
what
is the
might
best
not be.
idea. It is
Yeah.
the best idea. And what about the formulary? Is it on the web right away or until a few dates? Formulary of drug that changes every year for your drug prices.
Yeah, everything
Yeah, but
changes
when
every
it
year.
will be available? If I go
Yeah.
today on,
You
Are
don't
they-
know until you go to open enrollment and do a comparison.
I
But if
see.
you're new to Medicare, you can use the plan finder to determine a plan while you're enrolling for the first time in Medicare.
Right.
Okay, in that case, SHIP is the best choice for me.
That's what I think.
Guilty.
you
Yeah,
go
it is after our communication, I understand SHIP is the best choice.
I think so. Then you can lay out exactly what it is you're looking for and they can help you find the best plan.
Yeah, you are right.
Yeah, and
Thank
they're
you very
gonna
much.
ask
I
you,
appreciate.
Right, and they'll ask you questions. Well, do you have any other coverage right now? Are you retired? Are you still working? Are you able to afford this? Or, because a supplement costs money extra every month to buy a supplement plus a drug plan. If some people can't afford that, they might say, well, I can't afford the supplement and the drug plan, but I don't mind going into a Medicare Advantage plan. Not only does it have drug coverage, but it has these extra benefits that might assist me.
Right.
So
Right.
it depends on the individual. We cannot make a blanket
Of course.
that one is better than the other.
Yep. I think that this has been invaluable to me because, I mean, this is right around the corner. I'll have to figure out what I'm going to be doing. So the best part, of course, is that if I'm not clear, I can always go back to YouTube and watch it again.
Or you can call me,
That is fact. That is very true.
even though you're out of Middlesex County, I would be happy to help you.
Thank you, Charles. I do appreciate that. Thank you. Does anyone have any more questions?
I'm good, thank you.
Okay.
I'm good too. Thank you
All
very
right.
much. And it was a very nice presentation and I'm really happy to attend this presentation today.
Good.
Thank you.
Good.
Thank you very much.
Glad. Charles, thank you so much. Everyone have a really nice weekend. Stay safe. And we'll see you all at the next Medicare program.
Thank you very
Terrific.
much. Have a good day.
All right. Thank
Bye.
you.
Thank you. Bye-bye.
Thanks. Bye.